Hello, it's Dr. Gerard Ingham. I'm one of the senior GPs and directors at Springs Medical. I'm joined today by Dr. Beth Quin. Beth, there's been some quite significant changes in how we're operating because of the COVID-19 pandemic. Can you explain what's happening currently?
Yeah. So at Springs we've made really big changes to try and support social distancing. And given that the situation is that all of the doctors at Springs will be available and are encouraging telephone consultations rather than face-to-face consultations. So we're asking you all to book with your usual GP and keep having your usual health consultations via the phone. We've got your files available and your results available, and they can be really very high quality consultations in that context.
And you know, we can provide prescriptions and certificates. We've been sending the prescriptions down to the pharmacy or posting them and faxing and emailing certificates. So it's amazing. We've really learned quite a lot about what we can manage to do with the telephone consultation. That's not to say that we aren't still seeing people face to face. If there are things that need to be seen where we need to examine you, or there are other reasons why we need to see you face to face, then we will do. But we'd like you to presume that your consultation is going to be via telephone and ring and book a telephone consultation first. If on the telephone consultation the GP decides that you need to be seen, well then we'll arrange another appointment after that.
I think
that's keeping you safe and keeping us safe. We're really trying to reduce the foot traffic through here, aren't we?
Yeah, and our staff, you know, reception staff and nursing staff, we're trying to keep everybody healthy and available so that we can continue to serve the community.
Okay.
Yeah.
When it comes to people who actually do have respiratory symptoms like coughs and colds, again, a lot of those we can handle over the phone, but where we think that they need to be seen, we're generally trying to see them. They're coming in through a separate entrance, they're coming in at a different time of the day, and being seen, you know, wearing the protective gear and such to reduce the risk. Because we need to keep the Springs Medical Building, the facility here at Dalesford, and the same applies to at Trentham and at Kyneton, not to have any cases of COVID-19 here, meaning that we had to close down the facility.
Yeah. The other thing I've noticed, Gerard, is that a lot of people that I've been conducting the telephone consultations with are concerned that they're bothering us because we're busy, and we are busy, but it's important to have the consultations and reframe what your health management plan is in this context, and we can still and talk to you about any anxiety and help you develop strategies for dealing with those issues.
Because the mental health impact of what's going on at the moment, where everyone's leading, you know, quite extraordinary lives, and you only have to turn on the television to become unwell. So it's really useful to talk about that with your GP, and if some alteration in your treatment is needed relating to that, well, we're here to be able to do that for you.
Yeah. Yeah.
There are, of course, some things which we're trying not to do now, or we're putting off. What would they be, Beth?
Yeah, so the first thing which is hugely disappointing that we're unable to continue with is our CIS program, which has been the exercise program that's been really embraced by the community, and we would love to keep that going, but we're unable to in the gym. But we do implore you to keep exercising at whatever that is for you, whether it's just up and down out of a chair if you're elderly, or a more dynamic exercise. But exercise, we know, is crucial for your physical and mental health, so we really implore you to keep doing that.
And I'm aware that some people who can safely go outside are not going outside. It is okay for you to go out and exercise for a walk around on your own, not meeting anyone else. That's a safe activity.
In this environment, we are so lucky to have so much space around us, and it's glorious in autumn here at the moment. So we should absolutely make the most of that.
Good for your physical and for your mental health.
Yeah.
There are other things not being done.
So one of the things that is dear to me that we're suspending for the time being is the cervical screening clinic, or you may know it still as a PAP clinic. So Australia has a fantastic cervical screening program. we believe it's much safer to just delay your screening test for the time being until it's safe to be in the clinic. And so we'll keep you updated as to when that is, but for the time being that's suspended.
Yeah. And I noticed that like breast screen is suspended as well. So.
Yeah, breast screen likewise. It's much safer to be at home than have that mammogram and be in a crowded waiting room.
Yes, exactly. Not that we've got a crowded waiting room at the moment, it's very empty because we've been very effective with our current program. I suppose the other thing which is coming up, which people are constantly ringing up and asking about, is the influenza vaccine. I'd say to that, you just have to keep watching our webpage. We are updating it every day or every second day in terms of whether we have stock in. Currently, as I speak, we don't have stock in. We keep hoping for a delivery. And if we get a delivery in the next day or so, we will run a flu clinic this weekend. But please don't ring to ask whether we've got it in. If you do have access to the internet or do have access to Facebook, we will update there first of all. And we're also keen for those people who had already booked in for a flu vaccine in May, once we've got that in, we will contact you directly to make sure that you're able to get your influenza immunisation.
The one thing I would say about the flu vaccine clinics is that we're dividing them into 65 and over and then a different cohort, because the 65 and over vaccine is a slightly stronger vaccine than the other people, and also the 65-year and over group need to make sure that their pneumonia vaccine's up to date. Now that particular vaccine or that service is not, I believe, offered at pharmacies, so we would prefer our over 65s to have the government issued vaccine here because it's a better vaccine for them.
Yes, and currently, although we don't have availability, I think we will have availability soon, and we also think the environment which we offer to have that immunisation, we've been very conscious of having people coming in and going out quite quickly, very few in the building while that's happening, will create a very safe environment for the over 65s who are at the greatest risk in the current environment to have that immunisation safe.
Yeah, and the other thing to say about the flu vaccine is there's absolutely no need to panic. We've been delivering it later each year because we know that the closer it is to the flu season, the higher your immunity is. So we encourage you to not panic about the flu vaccine.
The final thing to say is, of course, the billing policy. We had made a billing policy change already. We announced that last week that all pensioners and healthcare card holders and those under 16 will be bulk billed. We're pleased to see the government's come along and increase the incentive for those when we do that. We've decided already to drop our charge, so we're pleased to see that they've come along. And we're very pleased with the government changes which have encouraged people during this time. They've recognised that people, because of their mental health problems or other problems, they need to be in contact with your GP. So, as you've said, Beth, I think your GP is available. We are busy, but we are available, and don't feel that you can't come, you can't bother us, because we are here. And it's particularly important that you keep in contact with your usual GP if possible during this time.
Yeah, and keep safe and well.
And be kind to each other. Thank you.